And welcome. We are preempting special report today because we are doing a 1-hour virtual town hall. We're going to be joined by Algoma Public Health, a counselor from the city of Sault Ste. Marie. And at the bottom of the hour, we will have someone from the Ontario Medical Association here as well. So basically, what we're talking about today is we have a mandatory mask policy put in by APH this past Friday. And also we moved to stage 3 on the same day as well here in the Algoma district. Perfectly timed that they both came in on the same day. So we asked a bunch of different people to participate. So we asked Algoma Public Health, which is Jennifer Flood. She's a public health nurse, and she just waved hi. Surrey Hospital was contacted. They chose not to participate. The Chamber was going to participate, but unfortunately, Roy Ring had a family emergency that happened yesterday. But we will be talking to him in the future. Ross Romano is actually on an announcement at 2 o'clock. So right following this, you'll see Ross Romano's announcement. Here locally as well. Terry Sheenan, as of the time we went live, has not responded to the request, and Mayor Provenzano has chosen not to participate. All of the city councillors were asked to participate, and the first one to respond was one that got on this show, and the other ones will be interviewed over the next few weeks. So thank you, Councillor Hilsinger, for joining us today. You were the quickest response. But next week, I will be interviewing Corey Gardy on Wednesday, and then also Dufour in a couple of weeks in the future, and also a couple of the other counselors as well. Well, thank you both very much for joining us today. We did ask a few business owners to come on, but none actually wanted to come on and ask their questions. So I'm going to ask them for them because some of them were kind of concerned about if they asked a question publicly on video, they didn't want it to come back on them as if they didn't want to be like cooperative with what's going on and masking and so on with our employees, but we'll get to some of those questions a little bit later. However, the first question we're going to talk about is the actual, because we've had different signs sent into us from different businesses. Everything in this I'm going to keep anonymous. I'm not going to say someone's name if they're from the public or what business this came from. But there's 3 different signs that we were sent in. One actually comes from my own apartment building. And so the question here, I'm going to read the 3 different signs, and then the question is going to be, how is the businesses being notified of what the policies are? Because there seems to be a little bit of confusion in that part. So, for example, my apartment building just says masks are required for all visitors and delivery persons, and please remember to social distance. And there's nothing on there that if you have a medical reason, you don't have to wear a mask or anything like that. There was one that was sent to us actually on Sunday, and I forwarded actually to APH and the city, and the business has been notified that what they posted was incorrect. Theirs was all persons entering or remaining in these premises shall wear a mask or face covering which covers the nose, mouth, chin as required under the City of Sault Ste. Marie bylaw number, and there's actually even a bylaw number on it. Now on that sign, it also talked about if you have medical exemptions or kids under 2 and so on. So that whole part of the sign was correct. However, they thought that there was a city bylaw. Another business actually did great. They actually basically cut and pasted from APH's website. But they also put on like, hey, if you see one of our staff members and they are not wearing a mask, it's probably for a medical reason. Please don't harass them. And if they're behind a plexiglass, they don't have to wear a mask. So please, leave them alone if they're behind plexiglass. So my question here is for APH, and that is, how is this communicated to businesses? Because those 3 signs say basically kind of 3 completely different things. There is no bylaw as far as Sault Ste. Marie goes. We'll get to bylaws in a second with Hilsinger. But how was this communicated to all the businesses? Because the ones that I have spoken to, they all seem to have a slightly different interpretation of what is required of them. And then we'll get into some of those nuances a bit later. But how is this communicated from APH to each business? So how would a business, for example, confuse it as being a bylaw, for example?
Yeah, so certainly. So when COVID-19 started, we did some digging and received some information. So contact information via emails for businesses all across Algoma. So over the past, 4.5 months, we've been also adding to that list as businesses contact us, people ask to be added. So the letter was sent to all the businesses that we have on that list, a compilation of, like I said, the information we received externally, information we already had internally from businesses we have been working with. So we sent it via an email blast to all those businesses. Local media also included it on websites where businesses could see it there, as well as the general public, and access the full letter, which had the details that you talked about regarding exemptions and all the fine details. We've also been taking calls, so if people call and ask us, we've been answering questions about it. So we've been connecting via all those channels and sharing widely as well. Also through social media, so all of our communication channels. We also, you talked about the different signs. So we actually did some of the front end work and created posters that were readily available. And those were also sent via that email. It's also up on our website where people can access it. And we made the ready to print posters. So the business owners do not have to do that legwork. We tried to, and we even created a generic policy that they can use. So we tried to take all of that front end work away from them, because we knew that, well, this is kind of new to them. Masking is not necessarily employers' expertise. So we tried to help them as much as we could through that. The confusion with the bylaw, I'm not entirely sure. I'm thinking where it may have come from. In the letter, we did state that this mandatory policy was coming under effect under the Ontario regulation, and quoted the regulation. So I don't know, maybe if that created some confusion. We, certainly with all the different regulations for stage 1, stage 2, stage 3, it does get confusing. So I can understand that.
Yeah, and over the weekend, actually, Mayor Provenzano tweeted out that he was at a grocery store and he saw almost everybody wearing a mask. His wife was over at Canadian Tire, and most people there were wearing a mask. I know that one of my fellow journalists here, he works at a gym here in town, and he went in on Friday, and most people were actually wearing masks almost the whole time they were working out. And then he went back on Saturday, and almost no one was. So, if, for example, like, people aren't following this mask policy, because right now it's APH asking people to. There's no fine attached to it or anything like that. This is for you, Councillor Hilsinger. If we see people sort of not following the mask policy, and just like at this gym, like first day everybody was wearing them, the next day no one was, and we sort of see people sort of, we'll call it mask fatigue, and they stop wearing them. Would you be in favor of putting in some sort of bylaw that would have a penalty to it to enforce the mask policy, assuming obviously going forward we don't have a vaccine or some sort of treatment in the next near future? Would you be in favor of doing something like that, or what would you like to see happen that City Council and the Mayor would be able to do with regards to that?
Well, thanks, Chris. What I'd like to see happen is people in our community continue to do what they're already doing, and following the very sage advice and direction of Algoma Public Health. And while it's not the fun thing to do, it's really necessary for us right now. And by and large, as you mentioned, the mayor has suggested, and others, I haven't been out very much because I am still trying to go out for what's necessary, as opposed to as we've been suggested that we would do. But I did have to do a couple of errands on the weekend, and everywhere I went and inside stores, I saw people wearing masks. So I'm hopeful that our community and our council would not have to ever discuss this, because people just get it. They know that they want to protect themselves and they want to protect others, and this is the right way to do it.
And what this as a follow-up actually to APH here, Jennifer, I've seen a few different studies. These are all anecdotal over in Europe, actually. Germany was comparing like one part of the country to another, and when they put in mask policy, what percentage of people need to be wearing masks for that to actually be effective? Because we know with like vaccines, you need to vaccinate a certain percentage for it to actually work. You don't actually have to vaccinate everyone. But as far as the mask policy, is there any sort of medical data out there that we know of? Like, does it need to be 50%? Does it need to be 80%? I know the thing I saw in Germany, I think it was over 70%, if I remember correctly. But that was even a month or two ago when that came out. So things are changing so rapidly with COVID-19.
Yeah, and that's it exactly, Chris. So because this is a brand new kind of virus out there, the evidence and research is in its infancy. So, but the early research, my understanding is around the 80% mark. So about 80% of the population needs to be masking in order to provide protection to the population as a whole. So. That's why, I mean, certainly we want all of the population that can and is able to wear it, because we do recognize that there are certain people that cannot. So the exemptions for medical breathing issues, as well as age, younger children. So we do need a good majority of those in the community who can wear it too, in order to protect, like you said, themselves and others. And I just want to echo what Councillor Hilsinger said, is that, you know, really as a community, we have been doing well. We certainly want to thank the community for all that they've been doing, the sacrifices. We know that it's not fun to stay home and not the most fun to wear a mask, but we've been doing well together, and we just need to keep this up. And hopefully, you know, a vaccine or something will come along and we can get back to, you know, more of a normal life as we know it.
Speaking of more normal life as we know it, we had a lady ask a question with regards to school. And she has kids, I'm assuming they're going into grade 2 and grade 8. She just said grade 2 and grade 8. Her question is, how safe will it be to send her kids back to school in September? Because we know that, like, school year is supposed to start right after Labor Day, which I believe is on September the 8th. So we're really not that far away from the school year starting. There's been all kinds of talking about different hybrid models, remote, and you know, smaller classes and so on. And you know, there's a protest yesterday at Queen's Park with parents and educators who want their kids back in full time the way it was prior to COVID-19. I don't think that's realistic, and I don't think anyone in the medical community thinks that that would be realistic in, you know, more or less basically 6 weeks from now. But what would you say to that mother who's concerned about sending her, you know, second grader and eighth grader back to school in a few weeks?
I'm assuming that's directed.
Oh, yeah, that's for you. Sorry, that's for you, Jennifer. Sorry.
So certainly, you know, we wanted to take a cautious route. I am confident. Again, from my knowledge, no decision has been made from the Ministry of Education, as well as the school boards, about what that model will look like. I am confident, though, that they are reviewing the evidence, the research, and also looking at other provinces and other countries that have implemented you know, school in different models to see what the impact is. So it's hard for me to comment when I don't know what that will actually look like. Certainly I do, you know, as a parent, all you want to do is protect your child, and it would be concerning, you know, there's lots of fears and unknowns about the disease. What I am certain is, though, that no matter how students are engaging in school, whether it's full-time, a hybrid model, that the necessary precautions will be in place when they go back to school, and whatever that looks like on September 8th.
Yeah, I mean, we can even within Canada, Quebec opened their schools partially as well. You know, I did a thing on schools a while back, maybe 2 weeks or so on my show, and there was kids in Taiwan, and they had what basically looked like popsicle sticks on their head, and there was just basically, they were wearing a hat, and on each side was a piece that stuck out 3 feet. So if they touched anyone else's piece, they knew that they were within the 6 feet and they had to separate. So there are plenty of inventive ideas out there. And the kids got to make their own hats. So they made it all personalized, right? And I can't imagine trying to corral a bunch of kindergartners and explaining to them what 6 feet apart is from every other person. So there is ways that we can do it. I mean, obviously, you're going to have to reduce the amount of people on buses, reduce the amount of people that are in a classroom, but there are ways that it is possible. It's just making parents feel safe at the same time. Okay. The policy, actually, this is also for APH, the policy that's in effect right now with the mandatory masks. With that policy, is there an end date to that, or is it indefinite for the time being? Because like for example, like certain parts of the provincial and federal government, they had to keep extending things every, you know, the border closure gets extended, you know, basically every month, things like that. Is this policy indefinite, or is this something that you're going to renew every 4 weeks? Like, is there an end date attached to this where it needs to be renewed, or is this just sort of ongoing?
So like everything with COVID-19, it is kind of fluid, regularly reviewed based on the, where we're at, what the numbers are telling us, where things are at a provincial, local, federal context. So at this point, it is indefinite, though the regularly reviewed, the need for it, how things are going. So at this point, no end date. So kind of continue with this policy until further notice, recognizing, like I said, that we are regularly reviewing and we'll be contacting businesses if anything changes.
All righty, thank you. I'm here with Jennifer Flood from Algoma Public Health and Councillor Donna Hilsinger from here in Sault Ste. Marie. We have to take a short break and we'll be back in 2 minutes. Hold tight.
The Government of Ontario established a $100 million affordability fund to help Ontarians who don't qualify for low-income conservation programs ease the burden of their electricity bill. Whether you rent or own your home, as long as you pay your electric bill, you could qualify. There are 3 levels of support available. The first is a home energy kit with upgrades like smart power bars and LED light bulbs. The second includes Energy Star appliances that help keep things cool during the hot summer months. The third is for electrically heated homes so that your power bills don't break the bank during those long Canadian winters. Plus, all upgrades, including installation, are completely free of charge. Visit affordabilityfund.org or call 1-855-494-FUND to find out if you qualify.
And welcome back. We are doing a 1-hour special on COVID-19, specifically the mandatory mask policy and stage 3 reopenings here in the Algoma district. I am joined today by Jennifer Flood of Algoma Public Health. She's a public health nurse there, and also with Councillor Donna Hilsinger from here in Sault Ste. Marie. We'll be joined shortly by Dr. Samantha Hill of the Ontario Medical Association, so we'll have a doctor in the mix shortly. Just following up on that last question there, Jennifer, what would APH need to see to lift the mandatory mask policy? Like, let's say we never get a vaccine, for example. Let's say this is something we can only manage with medication. So, for example, there's no vaccine for HIV, but we have medications to help if people do contract it. What happens if we can't get a vaccine for COVID-19 and we only have ways to actually treat it? What would have to happen for the mandatory mask policy to be lifted? I'm obviously throwing some scenarios out there that may or may not happen. We just don't know if we can do a vaccine or not, because we got to try it and see, the trials and so on. It's looking good for what's been going on, but you never know when it actually, large scale.
Yeah, you're exactly right, Chris. So again, things are looking hopeful for a vaccine, but nothing is 100% definite until it's ready to go and being presented to the public. As for lifting the policy, I'm not entirely sure of all the details of what that would include. Certainly, it would include, looking at what the evidence is showing us. The medical officers of health are constantly and regularly talking amongst one another. So that's the health unit leads across the province. So looking at what's going on in other areas, jurisdictions, what the evidence is telling us. As for what needs to occur to lift this masking policy, I'm not entirely sure. The reason it was put in place, though, is as things reopen, we want businesses to stay open. We know that, stage 1 and stage 2, and when many businesses did have to close, was challenging for the employers as well as those employees that were without work, both, from a financial perspective, but also a social perspective too. So work brings a lot of meaning to people's lives for many people. So as things reopen and we're not physically distanced in our home, we need other protections. So the mask was what was put in place in order to help protect people, in order for businesses, hopefully to keep the numbers low. So businesses can stay open, our numbers stay steady or reduce, and stage 3 occurs effectively without major impact to the community's health.
Speaking of businesses opening, I actually went out to a restaurant last night for the first time indoors. So that was kind of nice. Now, obviously, it was very, very spaced out. I mean, they literally just had like tables on the wall, and all the tables in the middle were completely gone. And I've talked to a couple of restaurant owners, and I don't know if they've reached out to you, Councillor Hilsinger, or not, but people are a little concerned, and they've expressed concerns to restaurant owners and managers and so on about why is it that servers are wearing masks and they barely touch my food, they just bring it from the kitchen out, but they don't necessarily have to wear a mask in the back. It's kind of optional, from what I understand from the few business owners I talked to with restaurants. The person who's cooking is actually in the back. It's warmer. They're right over your food for however long it takes to cook. What was the thinking behind that in terms of requiring the servers to wear masks, but not the sort of the backroom staff? And that's for you. Sorry, Jennifer.
Okay, so we do know, so COVID-19 is not a foodborne illness. It's transmitted, from what we understand, through mainly close physical contact. So the risk of contracting the virus through someone cooking your food is, extremely, extremely low. The risk of contracting it from that face-to-face interaction, close encounter with a server, that's the more likelihood. So our policy includes staff wearing it when they have close contact with clients. So when they're in an indoor space where members of the public are present. So that would include the servers, unless there's another physical barrier between them and the patrons that they're serving. Those in the back, the cooking area, the kitchen, are not having interactions with clients. Clients and patrons are not coming into the back. So that's why the policy wouldn't apply to them. And as I said, the evidence shows that, it's not a foodborne illness. It's the close physical contact that's our risk.
Okay. And have either of you been out to a restaurant since indoor dining has been allowed, or patios? Councillor Hilsinger is shaking her head yes. Okay.
Yes, I did actually last week. I did go to a restaurant and we sat inside. Yeah.
Okay. And how about you, Jennifer? Have you ventured out?
I have not been. Take out a few times, but not indoors at present.
Okay. This is actually kind of connected to a couple of questions previously. We've had several people contact us. There was actually a story out of Sudbury just today, actually. And there's been public shaming of people for a couple different things. One is not wearing a mask in public. People will say, like, why aren't you wearing a mask? Even though they could have a health reason, obviously. And, who knows what the person next to you actually has when you're walking through a store. There's also people who have license plates that are not from Ontario. There's one lady who has a Florida license plate who it was in the news today. And she's actually had like neighbors being like people see her when she drives around and she's got a Florida license plate on her car. And people are like, what are you doing here in Canada? Blah, blah, blah. But she's she's retired. She spends half her time in Florida, half her time here. And normally she doesn't have her Florida license plates because she leaves her car in Florida, but she couldn't fly back. So she drove back because she didn't feel safe flying on a plane. But now she's driving around with her Florida license plate, and people are just like, what are you doing in Canada? And meanwhile, she's like, I've been here since I was born. What do you have to say to people who are like public shaming people and stuff like this? Because I've seen it a couple times at Walmart where someone will be looking at someone like, why aren't they wearing a mask? Like my girlfriend suffers from asthma. She doesn't wear a mask. And like we were there yesterday and we got a couple funny looks at us. Like, what are those two young, healthy people doing without masks on? I mean, well, I have a heart condition and she has asthma. Both of them. I mean, I wore a mask once when I went to the hospital and I could not wait to get it off because my heart was like racing, and I take a medication to lower my heart rate. What would you say to the public with regards to this sort of public shaming that's been going on in terms of, you know, when you see people in stores or this lady with her license plate that says Florida and stuff like that? Like, obviously, everybody has their own reasons for not wearing a mask, if it's medical or you're under the certain age and things like that. But what would you say to your constituents, Hilsinger, to kind of put them at ease that, you know, not everybody has to wear a mask? You know, we only need that sort of 80%, as Jennifer was saying before. What would you suggest to people if someone does say something like to them about that?
Well, I think it's very unfortunate that some people would choose to chastise or, you know, speak to someone who, for whatever the reason is, they're not wearing a mask. I think that I used to say to my kids all the time, I probably still do to this day, it's like, you know, just worry about yourself, right? You just worry about yourself. It's your responsibility to carry yourself in the way that you know you need to do. And that's what you should do. And people, and if everybody had that, if everybody, which it would appear to me that most people are, you know, taking this very seriously, and doing what needs to be done to protect themselves and to protect others. So, you know, there's always people, whether it's on this particular matter or other things, who carry themselves a little bit differently in public. And I would just encourage everyone to know or to believe and trust in the residents of our community, and know that everybody's doing their very best under very difficult conditions, and we're going to be okay eventually. Yeah.
Okay. Thank you very much. We have to take another break. We are here with Jennifer Flood from Algoma Public Health and Councillor Donna Hilsinger who's a Sault Ste. Marie councillor. And when we come back, we'll also be joined by Dr. Samantha Hill of the Ontario Medical Association. We'll be right back in 2 minutes.
Did you know that 1 in 3 people are affected by fire in their lifetime? Or that 1 in 3 fire deaths happen in homes with no working smoke alarms? You may have just seconds to safely escape a fire in your home. That's why early detection of fire is absolutely vital. Only working smoke alarms provide those precious seconds you and your family need to safely escape. Install smoke alarms on every story and outside all sleeping areas of your home. For added protection, install a smoke alarm in every bedroom. Test smoke alarms monthly by pressing the test button. If the alarm doesn't sound, install a new battery. Replace alarm batteries at least once a year, and whenever the low battery warning chirps. And if the alarm still doesn't sound, replace the alarm with a new one. Smoke alarms have an expiry date. Remember to check the back of the smoke alarm for dates of manufacture.
Replacement is within the time frame on the manufacturer's instructions, in most cases 7 to 10 years. Always replace expired alarms.
Remember, it's the law in Ontario to have working smoke alarms on every story of your home and outside all sleeping areas.
Failure to comply with the Ontario Fire Code requirements could result in a fine or even jail time.
So protect yourself and your loved ones by ensuring that all your smoke alarms are functional and up to code. For more fire safety information, please visit www.saultstmarie.ca/firesafe.
though we can't always meet in person, we can still listen.
Even though schools are closed, help is still available in your community.
Even though you may be worried, services and supports are still here.
In stressful times like these, families need mental health supports more than ever.
We are here to make sure you can stay connected to your community and culture.
Nous savons qu'il peut être difficile de rester à la maison, mais vous n'êtes pas seul.
And we know asking for help for yourself and others can be hard.
But there are people in your community who are ready to support you.
No matter your age, gender, sexual identity, race, or culture.
No matter the day, time, or issue.
We're here to help.
We're joined today by Jennifer Flood of Algoma Public Health and Councillor Donna Hilsinger of Sault Ste. Marie. We will be joined shortly by Dr. Samantha Hill of the Ontario Medical Association. We just had a question actually just come in on my messenger, and the question is, what is the difference between the previous mask policy and the new one that just came in this past Friday? Since there's no enforcement, in other words, there's no financial penalty or anything like that. So what is the difference between the previous requests of people to wear a mask and the one that came in last Friday, I guess is the question they're asking there. Like, what is there any real difference, or is it just simply now it's more official in a certain way or something?
I guess I can take that question. So
that's for you, Jennifer.
Yeah. So previously there was no policy. It was maybe, advised to wear a mask when physical distancing wasn't possible. Okay. With the policy, though, I think, like you said, it kind of reinforced the importance of it, as well as it asked businesses to do three main things: that they had to develop a policy regarding customers and employees that did not meet any of the exemptions, so those that it applied to, put posters up that I had mentioned that APH has developed some that they can print and use, as well as verbally remind their patrons as well as their staff that masking is mandatory, unless, of course, they meet one of those exemptions. So I think it just kind of solidified the importance of it for kind of those that maybe were, not teetering on the edge, but those that, aren't against masking, but wouldn't unless it's mandatory. I think it helps support those, as well as the businesses, to clarify who should be wearing a mask. And as well also gave us the ability to provide some education to the public about, who should be masking, where are situations that, it's not appropriate, and that sort of thing. So I guess that kind of maybe is the difference, education versus policy, or recommended versus policy.
Okay, thank you. Well, welcome to live TV. We get questions on the fly. Hello, Dr. Hill. Welcome back to ONNtv. Thank you very much for joining us today.
Thanks for having me.
Dr. Samantha Hill of the Ontario Medical Association, and she represents the doctors here in Ontario. Alrighty. I'll give you a fun question up front, Dr. Hill. Hospitals, the last time we talked, we're having sometimes issues getting personal protective equipment. What have you seen since the last time you and I chatted in terms of the ability to get personal protective equipment, and are doctors happy with the amount that's out there now that they're able to, now that we actually can make our own even? Are you still seeing any issues in hospitals, or are doctors pretty happy with the personal protective equipment that's they're able to get their hands on?
Thanks for that. So what we're seeing is certainly a decrease in anxiety level around it. There's much less concern. People aren't hoarding their used masks as much as they were. But we are still seeing rationing. We're still seeing them handed out in sets of 2 or 1 for the N95. If you need to use an N95 mask, which is the highest level, you have to actually sign it out from a desk. And so there's still certainly a mentality of shortage as opposed to of a plethora of them. I think we're all acutely aware that we are in a reasonable state right now, but there's no guarantee that that's going to continue.
Okay. And actually, since you're a doctor, I have actually a immune system question here from someone. Does wearing a mask stop me from getting exposed to other viruses and germs? How will this affect me catching other illnesses? And is my immune system being compromised if I'm wearing a mask all the time by not getting exposed basically to other germs and viruses?
Okay, so first of all, I'm a cardiac surgeon, not an immunologist, so
Yes,
we will
yeah.
take this with a degree of
degree of salt,
uncertainty.
yes.
But the first and most important thing is that wearing a mask does not compromise your immune system. Period.
Okay.
End of sentence. I feel very comfortable saying that on TV.
Okay.
The second thing is that depending on which masks you're wearing, they have very differing protection to the individual wearing them. And so if we talk about masks made out of cloth material or bandanas, they probably offer less than 20% protection to the person wearing it. What they offer a lot of protection to is the people around that person.
Okay.
And that's the mantra you may have seen elsewhere about I wear a mask to protect you, you wear a mask to protect me.
Yes.
There's a variety of grades of masking. So from that cloth mask, you then go into medical masking, which has 3 or 4 tiers. And then you go up to that N95 mask that I was just talking about. And the N95 masks are pretty much as good as you're going to get, 99.9% filtration of any virus that's coming at you. But I guarantee you no one in the community is wearing one of those 24 hours a day, 7 days a week. When we have to wear them in the hospital, they're hard to wear for more than a couple of hours.
Oh yeah, I've seen pictures of like people after they've been wearing them for their shift, and they've got the marking all over their face. I mean, I'm sure it's uncomfortable to be wearing that for an 8, 10, 12-hour shift. But that actually leads me into another question, because you mentioned materials, and someone asked, what material is the best to make a mask out of, like cotton, polyester, like for the homemade mask? Like basically their question was, what's the best way to make and use a mask, and what material should I use? Cotton, polyester, or is there some other fabric? Like, is there a preferential fabric to be using?
So the only thing I can say about that is that it should be multi-layered. That's what we know, is that a 2-layered fabric is better than a single-layered fabric. Beyond that, you'd honestly have to ask an expert in materials about which material is better.
Yeah, I have seen people actually making them, and they've used a piece of fabric. They put a coffee filter, and then they put another piece of fabric, and then they sew it together. So there's actually 3. You got 3 layers to it. We actually showed one of those on the show, a couple on our morning show, probably 3 or 4 weeks ago, and someone had made a 3-level mask basically with cloth, the coffee filter, and then cloth again, and then sewn it all up. So speaking of masks, okay, someone makes one of these cloth masks at home. How should they clean them to disinfect them so they continue to use them instead of wearing the same mask and never cleaning it? What is the best way? And this is open to anyone who wants to answer this question. I'm not sure this falls into Hilsinger's camp, but yeah, she's shaking her head no. But the other two of you, Jennifer and Dr. Hill, is there any guidance on that? Go ahead, Jennifer, first. Yeah,
I can take it. So you want to wash it in the hottest water possible. So you do want to wash it, if it's a cloth mask, daily. You can wash it with your regular clothes, throw it in, like I said, hottest water possible. Regular detergent's fine. Wash it. Most of them are hang to dry, and then good to go. But you should not be wearing this day after day after day. It does need to be cleaned frequently. And usually the best thing to do is right when you get home, throw it in the washing machine so it's not hanging around in all areas of your home. So.
Yeah, and sorry, go ahead, Dr. Hill. Yep.
Sorry, I was going to say I agree with that entirely. You said someone will be wearing this day in, day out, and I was a little bit horrified. They should absolutely be changed. I'll even add to that, if you're going to do any strenuous exercise where you're panting, you should probably change it right after that. And a reminder to everyone that they need to do proper hand hygiene before and after they take off their own mask.
Yes, and actually, speaking of wearing masks, we actually have a question here. My neighbor wore a mask to cut his lawn. He was sweating and looked like he was having a hard time breathing. What could I say to him to convince him the face mask is not necessary when you're cutting your lawn? He's over the age of 60. She put he's a senior, so I'm assuming that's over the age of 60. There's very little chance of actually catching COVID-19 while you're out cutting your lawn. what could she say to her neighbor to make him feel that it would be safe to cut his lawn without his mask on? Because she said he was sweating profusely and it wasn't even a hot day. It was literally like, so what would you suggest that she could say to him that, you don't have to wear a mask? Like, is there anything on the APH website that she can point him to say, hey, you don't need to be wearing a mask when you're out doing yard work? Because he's not exposed to anybody face to face. I mean, it's not like he's, it's not like they're offensive linemen at a football game.
I'm going to take a stab at that and go in an entirely different direction, if that's okay with you.
Go for it.
What I'm going to say is we actually don't know why he was wearing a face mask. We don't know his side of the story at all. And so maybe he was wearing a face mask because he has intrinsic lung issues and he always wears a face mask. Or maybe he was wearing a face mask because the allergens from cutting the grass are bothering him and they've refrained from that. I think that it's really easy right now for us all to, I'm going to use the word judge each other, whether we're wearing a face mask or not wearing a face mask. And it's really easy for us all to have opinions on what other people are doing. And I'm going to suggest that this question is a really good time to turn inwards and just make sure that you as an individual are practicing best behaviors and modeling best behaviors, and leave it for others to make their own decisions.
You want to touch on that, Jennifer?
I agree 100%.
Okay.
Coming from public health and a background with behavior change, we know that, individuals need to make their own decisions and feel comfortable with that. And you can't judge a book by its cover. You don't know the rationale of why people are doing certain things or not doing certain things. And generally, I like to take the approach that they have a good reason why they are or are not doing things. So we can only, focus on ourselves and what we're doing. And so I agree with Samantha, as well as I think Councillor Hilsinger had mentioned that too.
Awesome. Okay. Next one. This is a journalist question. Okay. So this is compared to the 37 other OECD countries, Organization for Economic Cooperation and Development, Canada's long-term care home deaths are significantly higher as a percentage of the total deaths than every other country in the OECD. So 80% of our deaths were in long-term care homes. Spain was the next closest at 66%. However, the average for the OECD was in the low 40%. Do we have any knowledge or reason or why was ours percentage of deaths so much higher in our long-term care homes in terms of total deaths compared to every other sort of developed country that's out there? Dr. Hill or Jennifer, whichever one of you want to take a stab at that, because that's an interesting statistic. Ours was basically double in terms of the percentage of deaths.
So it is an interesting statistic, and I would hazard a guess that neither Jennifer nor I want to take a stab at it, but here's my best stab. First of all, with statistics as an
no one ever wants to answer the journalist questions, we ask the harder ones, questions.
Right? Yeah. So one thing is that not all statistics are created equal. And so a bit of a caveat that we don't actually know that we're comparing apples and apples there. We may be comparing very different statistics. We may have different populations in these long-term care centers. The data may be collected differently and reflect very different things. So it's very hard to compare that.
Okay.
That said, whether ours were double or not, I think everyone would agree that our rate or our incidence of death in long-term care was too high. It was tragic for people involved. It was tragic for families of people involved. And there is a real opportunity here for us to learn lessons and act on them, not just for the second wave of COVID, but for whatever the next thing coming at us is, whether it's the flu or some other disease. What we know is that multi-bed long-term care centers where PSWs or other healthcare workers go from one place to the other are challenging to protect the patients in any kind of infectious state because it's too easy to spread. And that really, it boils down to a lot of the things we talk about with any disenfranchised population. If you think about people who are living in group homes or in prisons, or you think about people who are just multiple families to a unit, right? When you can't segregate and you can't socially distance or physically distance, your risk goes up dramatically. And then, of course, PSWs were in a very short supply. And I don't mean to keep picking on them. I know there were other people there. It's just they were very prominent in the media as far as their role. And no fault of their own, right? If they have contracts that don't allow them to stay in one place, they have families to feed as well. And so there's a lot of things that have come out of this as far as where we need to do better to protect our most vulnerable. And that's something I think every physician, every nurse, every healthcare worker, and generally speaking, most of the population will agree on.
Yeah, we actually saw that with the hospitals here in town as well, because there's War Memorial on the American side and Superior Hospital on this side. And very early on, they said you have to work at one or the other. You can't work at both. And that was probably a very good decision by both hospitals to make sure that, you know, they weren't spreading one hospital to another and then take out both hospitals that happen to be the main hospitals in this area. So we did see that with hospitals as well. Okay, so we got to take a break and we'll be back in 2 minutes.
In your home, lighting is just as important as style.
With PowerView Motorization from Hunter Douglas, you can schedule your shades to light up the room. Create privacy, or both, automatically. No hands required.
So your shades will always be in the right place at the right time in style. And it's only from Hunter Douglas.
You as well. And you, Jennifer.
And welcome back. We are doing a town hall today. Obviously, it's virtual due to COVID-19. We're joined today by Jennifer Flood of Algoma Public Health. She's a public health nurse there. We are also here with Dr. Samantha Hill of the Ontario Medical Association, and she represents the doctors here in Ontario, and also Councillor Hilsinger of Sault Ste. Marie as well. And Dr. Hilsinger on the break there went and got a couple of her masks, and she wanted to share something actually about how she cleans them, because you don't necessarily have enough for a full load every day to clean them.
Right. And so we were talking earlier about washing them and throwing them in the washing machine and not wearing them more than one day, or if they were particularly, if you had exerted yourself. And so I just wanted to share and clarify with the experts here that it's okay not to just put them in the laundry machine, but if you had to wash them by hand with some laundry soap in the hottest water possible and then hang them to dry for the next day, that would be as good as putting them in the washing machine. I just wanted to make sure that I was right about that.
Yeah, you are correct. And just like you said, hottest or warmest water possible is the best. That's what will help kill the germs. So if you don't have access to a washing machine or you don't have a full load, that's another way of cleaning them on a daily basis.
Awesome. And wash your hands before and after.
Exactly.
Right on.
Wash your hands.
Right. Great.
Yes, lots of hand washing. We've been going through a lot of soap here at work and at my house. Okay, this is actually came out yesterday that the Trump administration bought the first 100 million doses of a Pfizer vaccine. Dr. Hill, are you concerned that there could be some sort of war going forward with regards to trying to get vaccines? Basically, whoever has the most money wins type of deal. We are developing vaccines in Canada, but who knows who's going to have the vaccine first? What are doctors talking about this at all?
Fair. So that's a scary question and a scary idea, I'm sure, for a lot of people. The idea that the rich will succeed and the poor will fail, it's definitely something that we as Canadians don't adhere to and we don't believe in. You might want to call me Pollyanna, but I have a sincere belief in humanity, and I think that there will be enough vaccines for everyone. If we find a vaccine that works and that is effective and that is safe, which are all things that need to be done, then we will mass produce them, and we will mass produce them wherever we need to mass produce them in order to be able to supply them to hopefully first the most vulnerable, but to enough people to maintain and to achieve that herd immunity that protects us from so many other diseases. I'm certain that when the MMR vaccine first came out, that's mumps, measles, and rubella for the non-medical people, I'm sure that there was also concern about that one. Was everyone going to have enough access, and how is that going to be distributed? We live in a country where there's lots of things to work on and lots of things to improve, but we do a pretty good job with public health thanks to people like Jennifer. And in that context, I think that that's not something we need to be ringing the alarm bells on just yet.
Yeah. Are you concerned about the much shortened time period here of creating a vaccine? Like, I've heard it normally takes 6 or 7 years, and the entire process here is being cut down substantially. That we could have a vaccine within like 18 months of beginning to try and create a vaccine for this. Like, is there any concerns we should have where we're not doing these sort of longer trials and so on?
I'm not particularly concerned. I'll let Jennifer take a stab at this after me, but there are very specific stages of scientific research, and one of the first stages is to make sure it's safe, and safe comes before whether it's effective or efficient. And you go through those stages of research to make sure that we are doing things in a stepwise fashion to protect people. We've seen what happens when we don't take those steps. We can think back to cases like thalidomide or other problems that have happened, and that is very much on everyone who's in the medical community's consciousness. We know these things, we have internalized them. So as the research goes forward, I'm certain that the people conducting the research are going to take all of the necessary steps. And the other thing to remember is that while this is a new vaccine, the steps in vaccine are fairly consistent. The adjuvants are fairly consistent. The other things that go into making a vaccine are fairly consistent. So the key for this vaccine, and now I'm speaking out of hand because I'm a cardiac surgeon and not an infectious disease doctor, is to find the right antigen that both triggers the immune response and lets you remember that immune response. And so, no, I'm not overwhelmingly concerned about the shortened timeline. If anything, I think it's exciting to know that we have the capacity to do that, and that we have the capacity to tackle other problems as well once this is over.
You want to take a stab at that as well, Jennifer?
I don't really have much to add. I just want to reiterate again that my confidence level is high. Okay. I highly doubt safety comes first and effectiveness, and until we can confirm those pieces of the puzzle, I am sure that a vaccine will not be put out without, like I said, checking those boxes. Nurses, physicians, we work under a moral and ethical code, so unless we can confirm the safety of things and medications, vaccines, whatever it may be, it would not be put out to the public. And again, vaccine development is not something new. Certainly we have vaccines for many different items, and as Dr. Hill had mentioned, the staged approach is similar, whether it's a vaccine for this, influenza, and other viruses and diseases.
And how do you respond to people who say that they feel wearing a mask is harmful to them for whatever reason that they have? I mean, we've also seen a couple small protests here in Sault Ste. Marie of people who are anti-maskers, and you hear crazy theories like, 5G is causing COVID-19 and crazy things like that. But How do you respond to people who are just kind of like, they think that a mask is harmful? I mean, unfortunately, the internet, everybody gets to say something. And, Twitter isn't necessarily the best place to get your news or medical information. How do you respond to people who go to sort of these, I'll call them alternative health, fake health sites and so on, and they're reading stuff that is just completely not scientific at all? How do you respond to these people that, oh, hey, wearing a mask actually is good? Because Trump calls it fake news, but usually what he calls fake news is real news. But how do you respond to people who are getting information from these sorts of sites and, saying, oh, wearing a mask is harmful? And I mean, there was that one protest, which was kind of funny. It was just the one lady and her parents that showed up to that protest here in town, the first anti-masker protest. But how do you respond to people that are just not getting the correct information? How do you reach out to them as a public health nurse, Jennifer, in this type of environment to try and get people to understand that not everything you read on the internet is true?
Yeah, so certainly, social media, the internet, we're on information overload. It's coming at us fast and furiously, and it is challenging to decipher real and credible information versus information that maybe is not so. So I guess first thing that we would do is educate them on credible sites. So whether it be, Algoma Public Health, that's often where we refer people to, Public Health Ontario, Public Health Agency of Canada. Those are credible sites where you can be confident that the information you are reading and getting is reliable, credible, evidence-based. So I guess just helping people navigate the world of the internet and the world of, online social media to make sure that the sites that they're gathering are credible.
Yeah, we've even had to monitor the comment section at SiouxOnline.com as well, because people have been pasting in, videos to 5G is causing COVID-19 and things like that. And it's just no, we're not going to allow a comment like that. We like to keep our comment section fairly open for different opinions, but there's been quite a few people have been posting things that are clearly conspiracy theories, and we don't wish to promote conspiracy theories here. So I'm going to end with a fun question. What does each of you want to do the most that you can't do yet? Jennifer, you go first.
Holy moly, why do I have to go first?
Okay. All right. Okay, Donna. Donna gets to go first. What is the one thing you're looking forward to doing most that you can't do right now because of COVID-19?
Well, the first thing that comes into my mind is I'm an amateur musical theater performer. Okay. And I really enjoy from time to time being in shows with people who over the years have become friends, and performing and singing together and so on. And as we know right now, that is a no. So I'm looking forward to the time when I'll be able to get back with those wonderful people and share some music together, all in the same room.
How about you, Dr. Hill?
Oh, it's so hard to pick one. Between
so there's a lot of things you're not allowed to do right now.
Yeah, between wanting my kids to go back to school and getting my hair cut and all of those things. But if I had to pick one, I would say hugging people again. I'm not a person who often hugs my patients, but every once in a while that happens. Hugging your friends, hugging family who isn't part of your social circle. That's probably, if I had to pick only one thing, that would be it.
Alrighty, and quickly, Jennifer, we only got about 30 seconds. What do you want to do?
I would probably echo similar to Dr. Hill. I've got some friends and recognizing that this has been a challenging time. And, during challenging times, my main way of helping people is giving them a hug. Okay. So hugging and seeing my friends up close would probably be easy.
Thank you very much, Jennifer Flood of APH, Dr. Samantha Hill of the Ontario Medical Association, and Councillor Hilsinger here in Sault Ste. Marie for joining me this hour. And have a great evening. Bye for now.
Bye, Chris.
Bye. Thank you.